Hi, my name is Tamer Mustafa. I'm a fourth year med student at the Ohio campus. I'm going to be talking to you guys a little bit today about primary idiopathic headaches, primarily tension headaches. So, just a little bit of background information about that. It's one of the most common conditions seen in the primary care practice. About 40 to 50 million Americans seek treatment for tension headaches annually. 1 in 6 Americans have chronic headaches that they suffer from. 23% of households contain a member with headaches. And just a really interesting um, kind of fact that I found was the prevalence of tension headaches are inversely related to the household income, meaning that the less money that you have, you're more likely you are to suffer from tension headaches. The incidence increases from 12 to 40 years old and then kind of declines after that in both sexes. The last thing is just kind of was also interesting was 1 to $13 billion are lost annually due to improductivity alone from headaches. Okay, so I just want to kind of move into the anatomy, the affected anatomy that could result or cause headaches. So the first thing you should do anytime a patient comes in and is complaining of headaches, you should always take a detailed history and then just kind of do an osteopathic physical exam, starting from their feet on the way, all the way up to their head, and just kind of look for any obvious abnormalities, differences in landmarks, um, just anything that kind of stands out to you, because a lot of times the cause can extend down into their thoracics, and that could potentially be causing their headaches. But more often than not, what you'll find is kind of occupational causes. If they're always sitting at a desk all day with their head flexed and kind of leaning over their keyboard, staring at a computer screen all day, whatever it may be, just having that fixed position day after day after day can kind of start to strain the paraspinal tissues, may start to give you tight sternocleidomastoids. A lot of times that can be your first place to look for causes of headaches. Um, so what we're going to do today is kind of two techniques that we're going to focus on. First one is going to be a soft tissue technique, and what we're going to do is we're just going to kind of do some stretching and some kneading. So what you're going to do is you're going to kind of cup your hand, and what you want to do is stay on one side of the vertebrae and just kind of cup that tissue and all those muscles back there, and you want to start to apply an anterior and a lateral force. So you don't want to really let go of the muscles when you start to go anterior and lateral. You always want to keep those muscle bellies in your hands, but you still want to apply enough force and traction to start to kind of stretch everything out. And once you kind of start to feel everything heat up, and a lot of times your patient can be the best guide. So what I like to do is always ask the patient, kind of tell me how they're feeling and how they think it's going. That can be, the best thing you could do, and can kind of direct you on how to go forward. So, Amit, how are you feeling right now?
Less tense.
Okay. All right. So what you want to do is kind of same thing on both sides. One other technique that I kind of like to use is I like to kind of with my other hand just place it on their forehead and side bend towards the area that I'm working on, and you could rotate away or rotate towards, and just kind of figure out what position exactly is going to give you the most, um, kind of soften that area the most and allow you to stretch it the easiest. So you can do this for about usually 30 to 60 seconds is the amount of time it usually takes for things to start to loosen up and feel a little bit better. And like I said, if you do need to go longer than that, your patient is always, kind of the guide on how long you should spend on things like this. So, I mean, how are you feeling right now?
Better.
Okay. You should always kind of reassess and go back and see how much of a difference you've made. Um, The next thing we kind of want to talk about is a suboccipital release. So what you want to do is kind of cup your hands. Um, so instead of using one hand now, we kind of want to use both hands and cup them. And what you want to do is just kind of come right under, lift the head up, and have the patient completely relaxed. And you want to get right under there in that suboccipital region. And you want, let's say, a majority of the patient's head on the pads of your fingers. You don't want to be using your fingertips just because that's going to be uncomfortable for you primarily, and it's not gonna really benefit the patient that much either. It's gonna be uncomfortable for them as well. So you want to make sure you're using the pads of your fingers and just kind of have the weight of the head sitting on your fingers. You're still gonna have some, some of the weight being supported um, by the bottom of your hand. The thenar and hypothenar is going to be holding some of that weight, but you still want to keep a majority of that on the pads of your fingertips. And you just want to hold it here again about 30 to 60 seconds. What you'll start to feel is the head will start to sink kind of further into your hands, and that can be a sign that the treatment is working. And a lot of times that'll be a sign that the treatment is kind of done. You'll feel just kind of the head sink into that open area, into that empty space in your hand. Um, but for me, I always like to ask my patient and have him direct me on how long I need to hold this. So, Amit, how do you feel right now?
About like 15 more seconds.
15 more seconds, you think? Okay. Yeah, and so that, I mean, as long as the patient is benefiting from it, you can continue holding it. But I can already kind of start to feel it, things starting to loose up a little bit. Um,
That's good.
okay. All right. Yeah, and I can start to feel kind of warmth and looseness in the suboccipital region. Um, so just a final thing to wrap up with. Some major contraindications to um, any technique, really. If they've got some open wound, an infection in this area, it's probably not a good idea to be playing around with that. Um, or if they have some past medical history, previous injuries, like something involving the cervical spine, or if they have some vertebral artery complications. Um, Generally, indirect techniques like this are okay, but if you want to do something like HVLA or more aggressive techniques, they're probably not a good idea to do if they have some history. Um, but other than that, patients usually tolerate kind of these indirect treatments pretty well. Um, so that about wraps it up for us. Thank you.